If you would like to schedule some online therapy sessions with me to help you learn how to work with anxiety or depression or addiction using mindfulness therapy, then please go to my website and learn more about this online therapy service. Seeing a therapist online is very convenient. It's also very effective as well, especially if you are interested in a style of therapy like mindfulness therapy, which is designed to teach you more effective methods of working with your anxiety or depression or addiction. Other styles of therapy are more treatment-based. That is, they basically try to apply a methodology that is supposed to make the anxiety or depression go away. I do not advocate treatment-based approaches or medications either, because they may provide a temporary solution, but they will do nothing to give you those tools that you really need to change the underlying psychological habits that cause your anxiety or depression or addiction. You have to work with those habits, and that is the focus of mindfulness therapy. It's designed to give you the tools that you can apply yourself to learn from your own mind how to work with these habits, how to resolve them, overcome them, and establish more positive habits that lead to well-being and happiness. Mindfulness therapy is a way of bringing conscious awareness to uncover these habits. So the first major issue with anxiety and depression is that we simply do not see those habits. They tend to become unconscious, and they become reactive. Like any habit, they thrive when they are unconscious, and they will continue to operate forever until you begin to bring consciousness to them. And consciousness is often described as the habit breaker. So the first step of mindfulness is bringing lots and lots of consciousness to your emotions and your thought patterns, whatever is creating your emotional suffering. The primary way we do this is to meditate on our emotions. Most people try to escape their emotional pain, and they use meditation to escape their emotional pain. But again, that approach is not going to heal the underlying process that causes your suffering. If you want to be free from anxiety and depression, then you must develop more awareness, not less. Now, the process of meditation is one of establishing a conscious relationship with your mind, with your emotions and thoughts, in which you learn how to stay present with emotional pain without becoming overwhelmed, without becoming identified with the content, and without becoming reactive with hatred or fear to those emotions. We have to stay present if you want to change your anxiety or depression. So we learn to develop presence, being totally present with our emotions. And that is the core concept behind mindfulness. It's all about being present. It's not about escaping from the mind. That is wrong teaching. You will find it out there. where people will teach you to avoid thoughts and focus only on the body or physical sensations, and that is simply going to create more problems because, yet again, you are not addressing the underlying cause of your suffering. So in mindfulness therapy, we do just that. We look at the underlying habits. First, we establish a non-reactive relationship with our emotions and thoughts. The second thing we do is investigate the structure of those emotions and thoughts. This is what makes the emotions work. Why are they so powerful, so overwhelming? And the primary mechanism that we explore when we look at the structure of emotions is emotional imagery. The imagery of the emotion itself is what, technically speaking, is the cause of the emotion. It's not the story, it's not the narrative, it's not the history, it's the imagery that is formed in the mind. That is what causes the emotion. Everything else is a trigger that triggers that imagery, but the imagery causes the anxiety or depression. So uncovering this imagery is a vital part of mindfulness therapy, and as an online therapist, I will teach you how to do this, how to work with your emotions using mindfulness. It's a very effective approach, and most people see really quite dramatic changes once they start facing their emotions instead of running away from them. So we work on changing that imagery. That's quite a central part of our work. And we become aware of that imagery by developing more conscious awareness to actually look and see how those emotions work. We also look for habitual patterns of reactive thinking, like rumination, or the sort of endless what-if type thoughts that we can fall into if we're not careful. So a second part of mindfulness is learning to wake up to these habitual reactive thoughts that tend to feed our anxiety or depression. And the same thing, when you see the thoughts clearly, then you can train yourself out of the habit of reactivity, of becoming overwhelmed by those thoughts. You can train yourself not to become lost in those reactive thoughts. You can learn to see the reactive thoughts as simply objects in the mind. You don't have to react. Just because the thought is there or the emotion, you don't have to suffer. The suffering is entirely due to this unconscious quality of the habit where we just blindly fall into the emotional reactivity that gets triggered. So learning to work with thoughts is very important because the thoughts feed the anxiety and depression. So those are two aspects of mindfulness work. And if you are interested in working with an online therapist who specializes in mindfulness therapy, then please give me a call. Contact me through my website, and let's schedule a Skype therapy session. And you will see for yourself just how effective this very direct approach can be for healing anxiety and depression. Addictions typically are behavioral reactions to anxiety and depression. So when you can heal the underlying emotions, you can take away the fuel that feeds addiction in the vast majority of cases. People usually use alcohol and other substances like that and drugs to try and escape their anxiety or depression. And of course, it simply does not work. It provides a short-term solution, as does prescription medications, but it does not address the underlying cause, and that's psychological. We need to work on those underlying blind habitual habits, and mindfulness therapy, in my opinion, is one of the best approaches to do this. So please contact me if this interests you, and we can schedule an online therapy session. Thank you.